Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes. Schizophrenia is a severe mental health disorder that affects how an individual thinks and feels and behaves. It's characterized by a disconnection from reality, and it can affect just about everything in their lives. So we're talking to psychiatrist Dr. Scott Murphy about that today, and we appreciate your time to be here, Scott.
Of course.
Let's talk about what schizophrenia is and what distinguishes it from other mental health disorders.
Absolutely. So schizophrenia is one of the more difficult illnesses that we treat in psychiatry. It can be a lifelong illness. It can start relatively young. Many people who are going to develop schizophrenia begin to show symptoms as young as their early 20s. And those symptoms tend to progress through the lifespan, particularly if they don't get access to adequate treatment. But schizophrenia is most characterized by what are called psychotic symptoms or psychosis. And this is a term that's very specific in psychiatry. It means someone has delusions, which are fixed false beliefs that are not culturally supported. And so they may have very firm beliefs that don't comport with the reality that the others in their environment are experiencing. And those beliefs might actually impact their lives in fairly negative ways. An example would be paranoia, would be a type of delusional thinking. And the other type of psychotic symptom is a hallucination. And that's defined as a sensory experience in the absence of an external stimulus. And so we can see, or we can hear, or even sometimes if we have a tactile experience that doesn't correspond with something that's really in our environment, but the brain thinks that it is. And so it's producing a sensory impression just as if we were seeing a person or an object or something in the room.
How is schizophrenia diagnosed?
So schizophrenia is most often diagnosed with the onset of a first psychotic episode. And again, this is another one of those psychiatric illnesses that can run in families. And so sometimes we do have a genetic background. We know that someone in the family has had the illness before. But this can be a fairly dramatic turn of events for a family. I have had patients whose lives were basically derailed by having a first psychotic episode. The good thing is that over the past half century, we have developed a lot of medications that can help both with recovery from these episodes and prevention of future episodes.
So let's talk a little bit about the medications. What kind of treatments are there?
So there's a family of medications that the first of them were developed in the 50s and 60s. They're called antipsychotic medications, and they antagonize a dopamine receptor in the brain. And they will pull someone back from an acute psychotic episode, but also when used as a maintenance medication, they can prevent the next one from occurring. A lot of treatment of schizophrenia is trying to find the right medicine for that person so that they get the best benefit with the fewest side effects.
Are there causes or certain risks that would be associated with the condition?
Substance use can be a risk for development of schizophrenia. In particular, there's a lot of data to support the intersection of cannabis use and schizophrenia. Generally speaking, it's thought that that represents a genetic risk that is sort of being uncovered by the substance use. And so likely the risk factors were there genetically. We can't know whether a person would have had an episode or not, but the likelihood goes up a great deal when there's substance use involved.
How does schizophrenia affect the social functioning, or how does it affect relationships with your family?
One of the earlier terms for schizophrenia, it was thought of as a type of dementia that started when someone was very young, and so it was considered like an early dementia. And in part, this is because over the lifespan, it can affect someone's cognitive abilities, their social interactions, and it causes a host of what are called negative symptoms. And negative symptoms are more defined by the lack than the presence of something. And so a person may withdraw from others. They may not be speaking as much, socializing as much. Some people with schizophrenia will isolate, and their families will find that they are just staying to themselves most of the time. So that creation of distance between them and their families can be very difficult.
Things to watch for. We've just really touched the surface on this condition, so we appreciate you explaining it and getting people familiar with it. There are a lot of people who will have to deal with this with their loved ones. Dr. Murphy, thank you so much.
You're welcome.
Thanks for checking in for Monday Health Minutes.